As a caregiver, you will likely find yourself in a situation when you will have to navigate different healthcare settings, such as hospitals, including the emergency department, long-term care homes, and home and community care. In any of these settings, you will interact with your healthcare team. This team consists of the patient and the healthcare providers, such as surgeons, specialists, nurses, pharmacists, physiotherapists, and family doctors, to name a few. As a caregiver, you are an integral part of your care recipient's healthcare team, and your contact information should be in the patient's hospital record. Hospitals can be intimidating places with many policies and procedures that you may not be familiar with. The best way to learn about what is going on is to get to know the nurses and let them know that you are the point of contact for the patient. Nurses are key sources of information for caregivers, can answer many of your questions, and provide practical tips for caregiving. Also, meet with the attending doctor and explain that you want to be kept informed of important test results and included in medical decisions. You should keep a running list of questions and find out when the doctor will be visiting patients so that you can be there to get your questions answered. Hospital social workers or case managers can provide information on coordinating care and local caregiving resources. At the end of a hospital stay, they often help with creating a plan for when the person is discharged from the hospital. There are several other staff roles that can also be a part of the healthcare team, such as dietitians, physiotherapists, pathologists, radiologists, and other specialists. In some cases, the specialist may be a surgeon who has expertise in one area. Home and community care support services, case managers, or care coordinators will determine your care recipient's eligibility for services depending on the level of follow-up care the patient needs. Patients who can continue to live at home with some support are discharged to their home with home care. Receiving home care means that you and your care recipient will receive visits at home by personal support workers. PSWs, as they are known, provide care and assistance to clients of all ages and their families and caregivers with tasks of daily living, such as personal care and hygiene and home management activities. Caring for people suffering from Alzheimer's and dementia at home can be especially challenging and requires time and patience from family and other care providers. In many cases, people with Alzheimer's and dementia cannot be left alone, requiring constant supervision, which can be difficult to provide long-term. Clinical behavioral response specialists can provide assessment, treatment, and care for older adults with cognitive impairment that can lead to challenging behaviors. Services are provided in the home, long-term care, and acute care settings, as well as during transitions from one care setting to another. To help navigate these and similar caregiver resources, visit the ETHP service directory. The link can be found in the description box below this video. For more information on navigating the healthcare system for your care recipient, watch our other navigation guide videos.